Hello everyone, welcome to the session. Today we will discuss psychological testing. The objectives of today's session are to learn about psychological tests, to understand the different types of psychological tests, to learn about the importance of these tests, and to know the phases of psychological tests. Psychological tests are written, visual or verbal evaluations administered to assess the cognitive and emotional functions of children and adults. They measure a variety of mental abilities and attributes, including achievement and ability, personality, and neurological functioning. Psychological tests are administered in a variety of settings, including preschools, primary and secondary schools, colleges and universities, hospitals, outpatient healthcare settings, and social agencies. For children, academic achievement, ability, and intelligence tests may be used as a tools in school placement in determining the presence of a learning disability, a developmental delay, in identifying giftedness, personality strengths and weaknesses. In tracking intellectual development or in diagnosing psychopathology like personality disorder, depressive disorder, intelligence tests may also be used with teens and young adults in career counseling. Psychological tests are mostly objective and quantifiable. However, certain projective tests may involve some level of subjective interpretation like inventories, measurements, questionnaires, and scales. They come in a variety of formats including written, verbal, and computer administered. Importance of psychological tests. Many parents, teachers, and school administrators regard psychological tests in school as a useful practice that supports children in achieving success in school. If children have undiagnosed psychological, emotional, or behavioral difficulties, psychological testing can detect these challenges and help schools place students in their best learning environments to meet their needs. Psychological testing can also be used to benefit kids with previously diagnosed conditions and to place them in classrooms where they can be motivated to grow both intellectually and personally. Psychological tests identifies weaknesses and strengths. Group administered achievement tests are the most common types administered in schools. The test results are used to determine a child's potential for achievement and to identify strengths and weaknesses. Once a test administrator determines the test results, he or she can identify areas where the student needs further instruction. If a child's test reveals he or she needs to enhance his math skill, he may be put in a specialized maths class designed to bring him up to the level of his peers. Psychological tests supports individualized lesson plans. Psychological testing in schools can identify students with disabilities or delayed skills and determine their eligibility for receiving individualized lesson plans. It allows parents to work with educators to craft lesson plans that help the child become successful in school. Student may also get a number of special support services depending on the outcomes of his or her psychological test. If a child's test determines that he or she is a visual learner with emotional problems, for example, a specialized series of lesson plans can be applied to the child's education to make the child more successful as the child works through his challenges. Psychological test enables placement decisions. The school psychologist, school administration, and parents take the test results into account when determining the best way to meet the child's academic and emotional needs. When a child demonstrates issues in reading, he or she may be placed in a smaller classroom of remedial learners until further testing reveals he or she is able to move into a traditional classroom. Psychological tests monitor progress. Psychological testing in schools allow monitoring a student's progress. Children are able to learn in ways that are appropriate to their current conditions. Next is the historical background. The history of psychological testing is fascinating and has abundant relevance to present-day practice. Contemporary tests evolved slowly from a host of pioneers introduced over the last 100 years. Although the widespread use of psychological testing is largely a phenomenon of the 20th century, historians note that rudimentary forms of testing date back to at least 2200 BC, when one of the Chinese emperors had his officials examined every third year to determine their fitness for office. The test assessed candidates based on their proficiency in topics such as civil law and fiscal policies. Psychological testing in its modern form originated little more than 100 years ago in laboratory studies of sensory discrimination, motor skills and reaction time. Early experimentalists such as Wilhelm Wundt, Francis Galton and James McKean Cattell laid the foundations of modern-day testing. The British genius Francis Galton invented the first battery of tests, a peculiar assortment of sensory and motor measures. In 1879, Germany, Wilhelm Wundt found the first experimental psychology laboratory. His structuralism relies heavily on a tool of assessment called introspection, whereby subjects try to describe their conscious experiences of a stimulus. American psychologist James McKean Cattell studied the Galton and then in 1890 proclaimed the modern testing agenda in his classic paper entitled Mental Tests and Measurements. In 1905, Alfred Binet and Simon published a 30-item scale of intelligence designed to help classify school children in Paris schools. The development of the Binet-Simon intelligence scale is largely recognized as launching a new era of measurement. In 1914, World War I brings about a boom in psychological testing as thousands of American recruits are screened for intellectual and emotional functioning. In 1921, Swiss psychiatrist Hermann Rorschach publishes his famous monograph Intellectual Ability. Psychological testing can be divided into 4 primary types. Let's have a look at them from the screen. First is clinical interview, assessment of intellectual functioning or IQ, personality assessment, and behavioral assessment. In addition to these primary types of psychological assessment, other kinds of psychological tests are available for specific areas such as aptitude or achievement in school, career or work counseling, management skill, and career planning. We will briefly describe achievement and ability test. Achievement and ability tests are designed to measure the level of a child's intellectual functioning and cognitive ability. Most achievement and ability tests are standardized, which means that norms are established during the design phase of the test by administrating the test to a large representative sample of the test population. Achievement and ability tests follow a uniform testing protocol or procedure, that is, test instruction, test condition and scoring procedures. And other scores can be interpreted in relation to established norms. Common achievement and ability test includes the Wechsler Intelligence Scale for children, that is WISC-3, and the Stanford-Binet Intelligence Scales. Next is clinical interview. Clinical interview is a core component of any psychological testing. Many types of mental health professionals can conduct clinical interviews, like psychologists, psychiatrists, clinical social workers, psychiatric nurses, among others. Specific clinical tests attempt to measure specific clinical matters, such as current level of anxiety or depression. The clinical interview is an opportunity for the professional to gather important background and family data about the person. The patient may have to recall or review a lot of life and personal history with the professional, who will often ask specific questions about various stages in life. Some components of clinical interview have now become computerized to help the clinicians formulate an initial diagnostic impression. Next is assessment of intellectual functioning, or IQ. IQ is a theoretical construct of a measure of general intelligence. There are two primary measures used to test a person's intellectual functions. They are intelligence test and neuropsychological assessment. The concept of IQ derives from about 1916, when a Stanford University psychologist, Lewis Terman, translated and revised the intelligence scale created by Alfred Binet and Theodore Simmons. In this instrument, Terman used the ratio of mental age to chronological age. This ratio or quotient concept led to the use of the term IQ, or intelligence quotient. For example, a 6-year-old child with mental age of 6 would have an IQ of 100. A 6-year-old child with a mental age of 9 would have IQ of 150. Intelligence tests are the more common type of administered and include the Stanford Binet and the Wechsler scales. The most commonly administered IQ test is called Wechsler Adult Intelligence Scale, 4th edition. The WAIS-4 is divided into 4 major scales to arrive at what is called full-scale IQ. Test of intelligence in educational setting. Intelligence tests were originally developed to measure learning potential. The author has for many years used measures of numerical ability, verbal comprehension, vocabulary, and abstract reasoning to predict educational achievement. There is no doubt that tests such as these give a fairly accurate indication of success in various subject areas. That is, they have good predictive validity. Used in conjunction with measures of actual academic performance, intelligence tests can help guide people towards appropriate career choices. They are widely used for diagnostic assessment where learning difficulties are suspected. Next is neurophysiological tests. These tests evaluate conditions such as ADHD, autism, concussion, and other learning disorders. Domains include attention, memory, language, visual spatial functioning, and executive functioning. It is a much more sophisticated level of understanding for clients that need it. Neurophysiological assessment can take up to 2 days to be administered and is more extensive form of assessment. It is focused not just on testing for intelligence, but also on determining all of the cognitive strengths and deficits of a person. Children and adolescents who have experienced a traumatic brain injury, brain damage, or other organic neurological problems are administered neurophysiological tests to assess their level of functioning and identifies areas of mental impairment. Neurophysiological tests may also be used to evaluate the progress of a patient who has undergone treatment or rehabilitation for a neurological injury or illness. In addition, certain neurophysiological measures may also be used to screen children for development delays and learning disabilities. Next is personality assessment. Personality is a complex combination of factors that has been developed over a person's entire childhood and young adulthood. They are genetic, environmental, and social components to personality. Our personalities are not shaped by one single influence. Personality assessment or test inventories evaluate the thoughts, emotions, attitudes, and behavioral traits that comprise personality. The result of these tests can help determine a child's personality, strengths and weaknesses, and may identify certain disturbances in personality or psychopathology. Tests such as Minnesota Multiphasic Personality Inventory for Adolescents, that is MMPIA, and Million Pre-Adolescent Clinical Inventory 3, that is MPACI, are used to screen children for specific psychopathologies or emotional problems. Another type of personality test is the projective personality assessment. Projective tests include the Ingblot test, the Thematic Appreciation Test or TAT, and the Draw a Person test. A projective test asks a child to interpret some ambiguous stimuli, such as a series of Ingblots. The child's response provides insight into his or her thought processes and personality traits, or may ask the child to tell a story about a series of pictures. Next is behavioral assessment. Behavioral assessment is the process of observing or measuring a person's actual behavior to try and better understand the behavior and the thoughts behind it, and determine possible reinforcing components or triggers for the behavior. Through the process of behavioral assessment, a person and or a professional can track behaviors and help change them. After a clinical interview, observing the person in a natural setting and taking notes. Clinical interview can be done at home or at school or at work or in a hospital or inpatient setting. Target negative and positive behaviors are observed as well as their respective reinforcements. Self-monitoring is also a component of behavioral assessment. For instance, when a person is asked to keep mood journal and track their moods over the course of a week or month, that is a form of self-monitoring. Inventories and checklists are popular nowadays, and also online form of quizzes can also be used as part of behavioral assessment. Psychological assessment encompasses a wide variety of types of tests, procedures and techniques used to help a psychologist better understand a person. Once psychological testing has been completed, the professional typically requires a few weeks to compile the data, interpret it, and write up a personalized assessment report for the individual. However, there are some precautions to be followed while administering these tests. These tests are standardized. Most printed tests taken by students and others are standardized. A test has been standardized after it has been used, revised and used again until it shows consistent results and average levels of performance have been established. The results of one's performance may be compared with those of many others who have taken the same test. Most teachers also use non-standardized tests that they make up themselves. The quality of a test is judged by three major standards. First is validity, reliability and practicality. We will discuss validity now. Validity reflects how well a test measures what it is intended to measure. For example, a test of reading comprehension could lose validity if it allows too little time for taking the test. It might actually measure reading speed rather than comprehension. Next is reliability. Reliability refers to the consistency of results achieved by the test. To establish reliability, a test may be given to the same group several times. If very similar results are obtained each time, the test may be considered highly reliable. Next is practicality. Practicality involves the cost and convenience of a test. If a test requires too much expense or effort, it may be impractical. It also may be impractical if the tests are too difficult to interpret. First, we will discuss the precautions. Psychological testing requires a clinically trained examiner. All psychological tests should be administered, scored and interpreted by a trained professional, preferably a psychologist or psychiatrist with expertise in the appropriate area. Psychological tests are only one element of a psychological assessment. They should never be used as a sole basis for diagnosis. A detailed clinical and personal history of a child and a review of psychological, medical, educational or other relevant records are required to lay the groundwork for interpreting the results of any psychological measurement. Cultural and language differences among children may affect test performance and may result in inaccurate test results. The test administrator should be informed before psychological testing begins. Next is preparation. Prior to the administration of any psychological test, the administrator should provide the child and the child's parent with information on the nature of the test and its intended use. Complete standardized instruction for taking the test, including any time limits and penalties for incorrect responses, and information on the confidentiality of the results. After these disclosures are made, informed consent should be obtained from the child and the child's parents before testing begins. All psychological and neurophysiological assessments should be administered, scored and interpreted by a trained professional. When interpreting test results, the test administrator will review with parents what the test evaluates, its precision in evaluation, any margins of errors involved in scoring, and what the individual scores mean in the context of overall test norms and the specific background of the individual child. In a school setting specifically, psychological testing can be as performance test, in which the test taker performs some specific task such as writing an essay, answering multiple choice items or mentally rotating images presenting on a computer screen. Next is behavior observation test. It involves observation of a person's behavior within a particular context. The next one is self-report measures, in which the test taker describes his or her feelings, attitudes, beliefs and interests. However, these are done in phases. Now we will see the phases involved in psychological assessment. So we can see here assessments are divided into 4 phases. First is interviews and information gathering. Next is testing. Then comes analysis, formulation and report writing. And lastly, feedback session to ensure accurate understanding and distribution of information. Phase 1. Interview and information gathering. At the start of the assessment, all of important stakeholders are identified. These typically include client, parents, significant other, therapist, referral consultant, psychiatrist or any other professional required. Parents are given a parent questionnaire to fill out prior to their interview to create an outline of relevant historical information, which is then detailed during the interview. Parents can submit their own narrative or timeline, which can help tremendously. Calls are scheduled with prior treatment providers. The purpose of the interview is to gather information as well as to understand the perspective and opinions of the interviewee. Phase 2. Psychological testing. IQ and achievement testing is done to determine the strengths and weaknesses of a person's thinking. General assessment domains include general awareness, attention, verbal comprehension, visual spatial ability, computation, abstract thought, impulsivity, problem solving, social comprehension, and judgment. Next is emotional. Assessing emotional functioning and assessing for depression like anxiety, deficits in identity formation, obsessive compulsive disorder, and sleep disorder. It assesses personality functioning, obtain data regarding developmental and emotional age, obtain data regarding family dynamics. Next is behavioral. It evaluates substance abuse, evaluates for trauma and abuse, evaluate for risk of self-harm, aggression, and treatment compliance or fight. It detects malignance, disease, and exaggeration. It also screens for behavior that are high risk, illegal, or violate the rights of others or major social values, including substance abuse. Executive functioning or EF. We believe EF skills should be evaluated with every client because EF skills are highly correlated with outcome, and EF skill development should be included into therapeutic treatment planning. Executive functioning assessment evaluates self-regulation, problem solving, planning, organization, inhibition, metacognition, working memory, and accountability. Phase 3. Feedback. Initial test findings are given to therapist and referral source as soon as possible so treatment planning can begin. When possible, we set a meeting or teleconference call with all the stakeholders to give feedback regarding testing and recommendation. This meeting can include parents, therapist, and educational consultant. With this, we have come to the end of today's session. Thank you for watching.